Okay, so cardiac ablation is a way to treat abnormal heart rhythm by delivering an energy, which is heating or freezing, to cause a scar in the heart, to treat the abnormal or to get rid of the abnormal signals which cause disturbance to the heart rhythm. So we deliver the energy through catheters or tubes to the heart to damage the abnormal signals in the heart and get rid of that. Good. So cardiac ablation is required for people who have symptoms caused by the abnormal heart rhythm. If they tried medication and the medication failed to control their symptoms, or if they tried tablets and the tablet is not effectively controlling their symptoms, and sometimes we offer cardiac ablation as a first line of treatment if we think the patient is at high risk of developing sudden cardiac death or troubles, or if we think that cardiac ablation is going to be very successful with low risk on the long term. So if someone prefer not to be on a long-term tablet for the heart rhythm trouble, they could be offered cardiac ablation as a first line treatment. The cardiac ablation is performed in the hospital in a specialized cath lab in the cardiology departments. We use different equipments like X-ray machines and 3D mapping tools to assess the procedure. We insert normally tubes, some rubber tubes through the groin, neck, or rarely through the neck or the chest wall, but the most common route is through the groin. People normally will be sedated and having local anesthesia, not general anesthetic, despite some procedure might be done under general anesthesia, but the majority will be done with local anesthesia and sedation. Through these tubes, these rubber tubes, we insert some wires, something called catheter. It's a long wire that goes through the blood vessel to the heart. And then by placing this catheter in certain areas in the heart, we can do study for the heart rhythm, and we can deliver the ablation to treat the abnormal heart rhythm. So cardiac ablation is a minimally invasive procedure. It's not like an open heart surgery. We normally do this procedure as a day case procedure under local anesthesia and sedation. The risk generally of most of cardiac ablation procedure is roughly 1 to 2%, but there are some times the procedure is having high risk if the actual heart rhythm problem is having high risk. So to be honest and to be clear, the cardiac ablation itself is not a high risk procedure, but the actual heart rhythm might be a high risk, which makes the procedure a little bit more tricky. But generally, there are 1 to 2% risk of complications, and the majority of the complications are minimal, like bruising, discomfort at the groin or the site of access, but there is very small percent, less than 1% risk of having significant complication or risk from the cardiac ablation. So catheter ablation is not suitable for all patients. Sometimes we prefer to start with medication first, but in some people, we prefer to have catheter ablation as a first line. So the decision is made as a joint decision between the patient and the treating cardiologist, and we assess the benefits and risks of having long-term tablets, offering catheter ablation as a first line of treatment, or going for medication first and defer ablation as a second line of treatment. That's a good question. So the catheter ablation, as I said before, it is a day case procedure. People will usually recover from that very quick. They go home mostly on the same day. We ask them not to drive legally for 48 hours and do light exercise or not exercise for the first week. After 1 week, most people normally fully recover from the procedure. Despite this, some of them have odd palpitation for the first few weeks, but generally they can exercise, go back to work after 1 week from the day of the procedure.